Sure. So actually, what is being done in the first trimester is called a first trimester combined screening. So I prefer to use the term first trimester combined screening because double marker means we look at two markers, beta HCG and papain in the mother's blood. Whereas when you say it's combined screening, it's going to integrate the nuchal translucency measurement as well, and even the presence or absence of the nasal bone, etc. So the appropriate term would be first trimester combined screening, which is done between 11 to 14 weeks. And this NT measurement should be done by a proper imaging specialist so that we can reduce the measurement errors as well, which is going to bias the final risk. And preferably, we ask the mother to give the blood on the day when the NT scan is performed. So, and the report is going to say whether the baby has got a high risk for Down syndrome or low risk for Down syndrome. The accepted cutoff is again when it is less than 1 in 250, we call it as high risk. And then again, these mothers are subjected for a proper early second trimester ultrasound, I would say. And also they have to be counseled about this meaning for this high risk in the double marker or first trimester combined screening. We need to give the options of further testing for these mothers, as you know. And in second trimester, as of now, the detection rates are much better for first trimester combined screening than for second trimester aneuploidy screening. Essentially, triple marker screening is in vogue, I would say. We are not using it in our practice. So instead, there's something called quadruple aneuploidy screening. So that is reserved for women usually who have missed the first trimester screening, and because the detection rate is lesser as compared to the first trimester combined screening. Whereas the counseling part for this also remains the same. If it is high risk, again, we have to talk about the presence of any soft markers or any major or minor congenital abnormalities, and we have to ask them to undergo further testing based on that.
So what are included in the quadruple testing?
So quadruple marker test, we look at, as the name suggests, there are 4 hormones which we are trying to look at. One is beta HCG and alpha fetoprotein and unconjugated estriol and inhibin A. So these are the 4 hormones we try to look at in a quadruple marker test.
The reason it's not as reliable is because it can fluctuate with the growth and the timing, the dates and things like that.
Yes.
And I mean, so you did the first trimester combined testing and it's abnormal. So would you ask for an NIPT or would you ask for a chorionic villus sampling in these cases?
Okay, so that's again a good question, and I think it's like when there is an increased risk alone, when the NT is normal, if we can just assume that the NT is normal, the nuchal translucency is normal, the nasal bone is present, and the baby is completely structurally normal, and after that, if the woman gets a positive high risk report for first trimester combined screening for Down syndrome, then again we call her and counsel, and we tell her that this is the possibility of the baby having a Down syndrome, and we give the options of cell-free DNA testing or NIPT. And we also, I also talk about the direct confirmatory test. And one thing about NIPT is till date, like even if the NIPT is going to be positive, the confirmatory test is going to be the direct fetal testing. So I put all these options to the patient.
Just for the benefit of those who don't know NIPT, I mean, basically it's non-invasive prenatal testing and you're harvesting the fetal cells from the mother's blood. Is that right? And then you are looking mainly for the trisomies and the sex chromosome abnormality. You can't look at the wider genetic picture. So that's why it rules out the trisomies to some extent. The sex chromosome abnormalities are not as reliably ruled out. Maybe a 5 to 10% chance of missing them or having a false positive result.
Yes.
And
in terms of, increasingly there have been labs which are coming up with cell-free DNA testing for even all the chromosomes. But still, up to my knowledge, until whatever the evidence says as of now, it's still going to be a best screening test, and it's not going to replace the direct fetal testing.
What about the turnaround time?
the turnaround time usually it is like here, I would say like in India, it will be maybe around 7 to 10 days.
And if you do CVA,
Sorry?
if you do chorionic villus sampling and send it.
Chorionic villus sampling, again, depends on what we are going to test. If it's going to be a PCR or a FISH for the common aneuploidies like chromosome 21, 18, and 13, it's going to be like maybe 2 or 3 days. And if it is going to be like, if we are ordering some other test, whenever there is additional ultrasound finding, which could point not just the chromosomal numerical aberration, which could, in case if it's going to represent even the possibility of chromosomal structural problems like microdeletions and microduplications, we go for microarray analysis or CMA, and that takes about a week's time.